If you currently have or are considering a Medicare Supplement Plan N, there are some post-pandemic changes that you should be aware of. In fact, the last time I published a video comparing Plan N to Plan G was November of 2020. This is what I said about Plan N in that late 2020 video that I now must change. The $20 copay is for diagnosis and evaluation visits only. There's no copay for physical therapy. There's no copay for when you get a flu shot. There's no copay if you end up with cancer and have chemotherapy infusions once a week. There's no copay for telehealth meetings, and there's no copay when you go to an urgent care center. The copay is only for an in-office visit for diagnosis or evaluation. In this video, I'm going to update the information on Plan N that you need to know and show you how to decide between a Medicare Supplement Plan G and a Supplement Plan N. This is an important video. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. My company is one of the premier Medicare insurance brokers in the United States. We're an independent insurance broker specializing in Medicare and retirement needs, and our services are free to you, the consumer. If you like these videos, you're not alone. My Medicare Explained videos are YouTube's most popular educational videos on Medicare. So check out our 5-star reviews and call us. In my Medicare Explained video, I described the 3 choices that you face when you enroll in Medicare Part B. You must make one of 3 choices. If you missed that video, it's linked above my left shoulder and of course in the video description below. If you're watching this video, it's likely you've already chosen or are seriously considering a Medicare supplement plan. That's a good choice. Why? Because with a Medicare supplement plan, you keep the 2 most important features of Medicare. You can see any doctor or go to any medical facility in the United States or U.S. territory as long as they accept original Medicare. You're not limited to a network, and you don't need to get a referral to see the doctor of your choice. In addition, no insurance company has a say in your health care. No insurance company can demand your doctor seek their pre-authorization before providing you the treatment that they recommend. No insurance company can deny your coverage. Your health care decisions are between you and your doctor. You give up both of these rights when you choose to trade in your Medicare for a Medicare Advantage plan. Now, if you're unclear about what I just said, please rewind and replay that. We found in the many thousands of people that we have helped with their Medicare, keeping those 2 features, freedom of choice and control, are what drives their decisions towards Medicare supplement plans. So how do you choose between a Plan G and a Plan N? It's really not that complicated. Now, while this video is mostly about Plan N, because it's difficult to describe Plan N without comparing and contrasting it to Plan G, we'll start with a brief description of Plan G. So Medicare Supplement Plan G is the most comprehensive healthcare coverage you can get in the United States. With a Medicare Supplement Plan G, you can spend a year as an inpatient in the hospital and it won't cost you a dime. Medicare Part A is your inpatient coverage, and when you add a Supplement Plan G, Medicare and your supplement pay 100% of your inpatient Medicare stay. It's full and complete inpatient coverage. Now, for outpatient and physician services, your only expense will be the annual Medicare Part B deductible. Now, this is Medicare's deductible, not your supplement. Part B is your outpatient services coverage with Medicare, and with a Plan G, everything is covered at 100% except you will pay the first $226 billed to you in 2023. That's the 2023 Part B deductible. It can change from year to year. Medicare has commented it expects that deductible to reach $250 in the years ahead. Once that is paid, your Medicare and Plan G will pay all your other inpatient and outpatient services for the rest of the calendar year. Medicare Supplement Plan G is what we call your peace of mind plan. You have no office visit copays and no coinsurance. Your annual maximum out of pocket is the Part B deductible. Again, for 2023, that's $226. And by the way, the term annual maximum out-of-pocket refers to the maximum amount that you are liable for your medical bills in any calendar year. It does not refer to your premiums. So does that make it the best Medicare supplement plan? No, not necessarily. The best Medicare supplement plan is the one that's right for you. Plan G has its downsides that you must consider. The downside, though, isn't health care coverage. It's cost. It's your premium. So I'm going to compare the cost between the Supplement Plan G and Plan N in a moment, and I'll share with you how I measure those premiums to find the best value. But first, let's look at the Plan N and what has changed. So what is the Plan N like? Well, it's full coverage, which means that just like Plan G, you can spend a year as an inpatient in the hospital and it won't cost you a dime. Also, like the Plan G, you'll be billed for the annual Medicare Part B deductible when or if you first see a doctor during a calendar year. Now here's where Plan N differs. There's also a small office visit copay when you have a doctor visit for a diagnosis or evaluation. And that brings us to the clip that I played at the start of this video. In 2010, when Plan N was new, Medicare released a clarification on the copays that gave up specific billing codes required to charge an office visit copay. The office visit copay is 20% of the bill up to a maximum of $20. It can be less than $20, but no more than $20. Those billing codes were exclusive to in-office visits to your primary care physician or a specialist and can be no more than $20. So Medicare's guidance specifically indicated there's to be no office visit copay for telehealth or urgent care visits. During the pandemic, under part of the emergency order, billing rules were bent for telehealth, doctor visits, and urgent care. In both cases, Medicare quietly allowed doctors to bill these visits using the same billing code for in-office primary care visits. So where telehealth and urgent care visits were originally excluded from the $20 copay prior to the pandemic, doctors are now allowed to charge the copay for those visits. Originally, these were intended to be short-term exceptions during the emergency of the pandemic, but the emergency, as declared by the government, has extended much longer than certainly I've ever anticipated. And Medicare has intimated that changes in consumer habits warrants a likely permanent change in the billing guidance. So when they release the emergency, they're likely to keep these exceptions, these changes in place. So what visits are excluded from the copay? Well, there's no copay charge for physical therapy, there's no copay for preventive care or flu shots, and no copay for chemotherapy or infusion treatments. The copay is still just for doctor visits that are intended to diagnose or evaluate your condition, but that now includes urgent care and telehealth visits. Now there's one other feature of Plan N that differs from the Plan G, but before I continue, I'd like to ask a favor of you. If you've found this information helpful, please press the like button and subscribe to my channel. Obviously, I have a lot more great content coming out. Well, I think it's great. But doing so helps me, and it helps others who have questions on Plan N find this specific video. So thank you in advance. So there's one other feature of Plan N that differs from the Plan G, and that is that Plan N has no insurance against the Medicare Part B excess charges. Now there are some states that forbid excess charges outright, and I'll list them here in a moment. Let's first answer the question, what is an excess charge? And this is important because there are a lot of people that don't understand that a doctor can't just charge an excess charge at any time. So when a doctor decides to accept Medicare insurance, they must choose between one of two different contracts with Medicare. There's a participating contract or a non-participating contract. Now, according to Medicare, more than 98% of doctors will choose what's called a participating provider contract. And this is a fancy way of saying that they agree to only charge the rates that Medicare assigns. In return, they will only bill Medicare. Medicare is a one-stop biller. Medicare then communicates electronically to the supplement company, and yes, they know what supplement you have. and informs the supplement company of how much to pay and to whom. On average, 85% of medical bills are paid by the supplement company within 48 hours and with no human intervention. It's all automated. Not many people will catch what that really means to them, so here's the key takeaway. The electronic communication from Medicare to the supplement company is why your doctor will accept any Medicare supplement from any insurance company. The doctor doesn't bill your supplement company. They bill Medicare, and Medicare takes care of everything for them. Those are participating providers, those that accept Medicare assignment. So what about the non-participating providers? Well, there are fewer than 2% of the doctors in the U.S. who accept Medicare will choose the non-participating provider contract. And these are the ones that are contractually allowed to charge an excess charge. So they're paid 5% less by Medicare than the provider who accepts assignment, and then they're allowed to charge up to 15% more on that lesser amount than what Medicare paid them. So that is the excess charge, up to 15% more, no more. They can choose to charge an excess charge on a case-by-case basis, and that means, of course, that you can negotiate. Now, very few doctors will choose this contract because Medicare penalizes them. Medicare will not be their one-stop biller. They must bill Medicare, but they cannot bill your supplement. They don't have a contract with your supplement, and Medicare will not do it for them. So the easy way to tell if your doctor charges an excess charge is that they'll ask you to pay up front for your services and then get reimbursed by your supplement company. You can also find out by looking them up on the Medicare.gov website. So a couple quick but important points on excess charges. There are no excess charges for Part A inpatient services. None. There are no excess charges for emergency services. They're not allowed. And lastly, if you go to a doctor or a hospital, either everyone in that doctor's group or hospital charge an excess charge or no one does. It's an all or done, and that's in the contract for group. There is an exception for teaching hospitals under certain circumstances, but the truth is that doctors who charge an excess charge are so rare that you're unlikely to ever come across one the entire time that you have Medicare. I mean, think about it. Less than 2% of the doctors that accept Medicare will charge an excess charge, and 40% of those are psychiatrists. So let's look at the states. As I mentioned earlier, there are 8 states that forbid excess charges. So doctors in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont cannot charge a Medicare excess charge. In my opinion, that makes Plan N the best value full coverage plan in those states. So how do I determine if Plan N is a better value? Well, let's recap Plan N first and then how to determine if it's the best value. So Medicare Supplement Plan N has full coverage, but not as robust as Medicare Supplement Plan G. With Plan N, you'll pay that $20 office visit when you have a diagnosis or evaluation, and you have to avoid doctors that charge an excess charge. What makes Plan N attractive is that the premiums are lower than Plan G, and the price increases are usually lower than the Plan G as well. It's friendlier on the budget. Plus, some states outlaw excess charges altogether. So now I'm going to show you how I determine if Plan N is the best value. Medicare supplement prices are all over the board. Prices are influenced by where you live, your age, your gender, and most importantly, the insurance company you choose. And I'll touch on the insurance company question in a moment. Value is not an absolute amount across this country. So I can't say look for a Plan N under $100. There are some states where you can't find a Plan N at that price, and other states that $100 Plan N would be considered expensive. So here's what I do. I subtract the price of a Plan N, the monthly premium, from the price of a Plan G. And then I consider that difference relative to the Plan N office visit, the $20 copay. How many office visit copays will it take for the Plan N not to be a good value? In some states, you'll find a Plan G is $30 to $50 a month more expensive than a Plan N. Well, at $30 a month, that's equal to the Plan N copay for 1.5 visits a month, or 18 visits a year. If you're not seeing a doctor 18 times per year, every year, then the Plan N is a better value, because even after you pay that copay, Plan N is a lower price. There are some states where Plan G is only about $10 a month more than a Plan N. And in that case, it costs so little to have the upgraded benefits of a Plan G that Plan G is a better value. To find value, look at the difference in monthly premiums in terms of how many office visit copays it will buy. Of course, value, like beauty, is in the eye of the beholder. By comparing and contrasting these plans this way, you'll be able to determine which is your best value. So now comes the final and most important piece of information that I'm going to share with you in this video. The biggest decision in determining what you will pay for your supplement over your lifetime is not which plan you choose. It's which insurance company you choose. I've made a couple of videos on this topic, but suffice it to say that you can pay more for a Plan N over your lifetime with the wrong insurance company than a Plan G from the right insurance company. And that's where I come in. My decades of experience and financial background provide me with a unique set of skills, if I'm to borrow that term from Liam Neeson in Taken. I don't think I'm as good looking and big as he is. Anyway, I help you find an insurance company whose products are reasonably priced today and expected to be reasonably priced in the years ahead. Will it always be the lowest price? No, no one can make that prediction. But I can tell which companies are going to abuse their price increase abilities and which ones not. We cannot escape price increases, but we can minimize them and manage them in the years ahead. My team evaluates your plan and insurance company every year, so you never have to worry if you're still in the right insurance company or right plan for you. If we can help you with your Medicare, please contact us. You'll be glad you did. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.